Hello, and welcome to another edition of the Wine Enthusiast podcast. This first episode of 2025 in January. This dry January, which mercifully is almost over. I'm John Capone, executive editor of the magazine, and with me today is Michael Alberty, who reviews wines from Washington and Oregon for the magazine and is a writer at large for us. He's been working for more than a year on the story we're talking about today, which relates to a Neo-Prohibitionist movement taking hold in America. And you'll find that story in the winter issue of Wine Enthusiast. When he and I first started talking about this story, it was at the end of another long, dry January. And when we talked about the roots of that social media trend, which seems on the face of it a good one, and we are just as guilty as other media outlets doing the requisite New Year, New You wellness stories each year. But dry January has its origins in Europe and England and stems from temperance movements there and a rise of neo-prohibitionists that is coming to the United States. Michael, you first came to me last year. I was at CiderCon in Portland and we were in that entrance area and you said, have you seen what these PSAs that Oregon Health Authority is running? I hadn't, and you told me exactly what they were, that they had just hit the airwaves, and what were those PSAs?
Well, so the Oregon Health Authority is a state agency in Oregon that basically has control of all the most important health and medical decisions in the state. They control the Medicare programs, the Oregon State Hospital. It's a huge organization that does a lot of great work, and they have a gigantic budget. A couple of years before we talked, they had launched this campaign called Rethink the Drink. And the ads were just kind of, I don't want to say innocuous, but nobody took a lot of notice. They were very kind of vanilla public service announcements about alcohol consumption. And then the second round hit last December, so literally December before last. And I'm like sitting at home watching a football game, and on comes this ad where there's this father and his daughter having a conversation in a grocery store where the little girl asks, "Can I drink that bottle of wine you're about to pull off of the shelf?" And he says, "No, you can." She said, "Why?" And he goes, "It's not good for you." And she goes, "Is it good for you?" And he kind of looks at the bottle and then he puts it back on the shelf, and the two of them smile at each other and off they walk away with their grocery cart, which, by the way, still contained a case of beer in it, which the dad had told the daughter was for the Ducks football game that weekend. The beer stayed, the wine went. And the strong implication of the ad was that drinking wine's not good for you. And this caused a lot of drama in the state of Oregon because on the one hand, the state of Oregon, through the Oregon Wine Board, pays money, subsidizes the wine industry to a certain extent through the Oregon Wine Board. But on the other hand, we're spending even more money to run campaign ads to suggest to people, maybe you should put that bottle of Oregon wine back on the shelf and don't drink it. It seemed like we were at dual purposes here, and people were a little concerned about what the ad meant and what the direction of the Oregon Health Authority was going. If you would run this ad called why drink that bottle, put it back, suggesting that, it's not a good thing to consume. The wine industry here really sat up and took notice, just like I did that day. I literally almost fell out of my chair when I saw it. I couldn't understand it. Wasn't sure why they were doing it. Wasn't sure why beer stayed in the cart. But it was pretty clear to me that all the things that I've been hearing from friends in Europe and Canada about PSAs going after alcohol and wine consumption was all of a sudden in my living room. It was here. And this is Oregon. We're in the heart of the Willamette Valley in Southern Oregon, the Gorge. We are surrounded by robust wine regions, very successful wine regions that are really important to the economy of the state. So if this could start here, I thought this neo-prohibitionist message could go anywhere. And it already has, but that's where we're headed.
And at that time, I mean, it was early on. You've been tracking the story for a long time. I think our first question was, where is the money for these ads coming from? OHA is pushing this message. And as you started to look at that, what did you find?
It's just out of the state of Oregon, Oregon Health Authority budget. There was some federal grant money for it, but that was the main impetus of the money. We can talk about the influence of Neo-Prohibitionist organizations and Neo-Prohibitionist-oriented researchers that are providing information that's being used. But
Who's driving OHA to do this? I mean, who's advising them and driving them?
well, the Rethink the Drink campaign, when it was originally created, was we had a different director of the Oregon Health Authority at that point, a gentleman named Patrick Allen, who then moved on to New Mexico. And when he organized this, it was basically a group of over 30 organizations that sat down to try to come up with a campaign. And that group of 30 organizations included a lot of local community organizations, a lot of recovery organizations, rehab organizations, people trying to help people that were struggling with addiction. Those kind of agencies were involved. And so they had an influence. And probably one of the biggest influences in my mind would be a group here in Oregon called Oregon Recovers. And at that point, they had a director named Mike Marshall who stepped down as he ran unsuccessfully for the mayor of Portland recently. But he was a very vocal critic of the alcohol industry and the wine industry, thought that there should be significant increases on excise taxes on alcohol products in the state, ostensibly to provide money for more recovery beds in the state of Oregon. But, the point was to get an excise tax, an increased excise tax slapped on wine, beer, and cider. But interestingly enough, the excise tax proposals that actually made it to the legislature ignored hard alcohol. And in our state, it's a little complicated because we're a state-controlled liquor state where the state of Oregon is administering distribution sales in state stores, sort of like Pennsylvania. So it was interesting that the excise tax that was in the state legislature a couple of times was directed at alcohol, wine, and cider, but not hard alcohol.
Are they singling out focusing on wine, especially for any reason because it has so much visibility in the state? Or
I have thoughts about that because in that Y ad, you're taking a bottle of wine and putting it back on the retail shelf. And they did in other public service announcement ads mention or show people drinking beer and things like that in other ads, but none of them were as pointed as the Y ad, which was, why drink wine? And suggesting it's not good for you, put it back on the shelf, and the beer stayed in. We thought about wine being kind of a more elitist target, and beer being more of a working class kind of thing. Why the beer stayed in the grocery cart, I have no clue.
yeah,
But
the beers for the Ducks game, right?
yeah, the beers for the Ducks games, kick back, the elitist wine bottle, go back on the shelf. I don't know.
And after doing all this reporting for the past year and talking to all the people who you have, what do you see are the aims of these organizations? Like, what is their ultimate goal?
Let me go back to a year and a half ago. I had a conversation with a gentleman who's in the Oregon wine industry at an administrative level. And he pulled me aside and, well, not pulled me aside, but very quietly on the phone, he said, there's forces gathering around the world that are neo-temperance, neo-prohibitionist forces, whatever you want to call them. He goes, they're not only gathering, they're beginning to coordinate. And they're beginning to meet sometimes quietly, sometimes in the open, sometimes on the floor of the World Health Organization, sometimes, you know, uh, with money being paid to a researcher to travel from Canada to Sweden to Stockholm, where one of these organizations is headquartered to give talks, to help prepare research reports. And when I first heard him say that, I thought, I think this guy's being a little overly paranoid. But now that we're a year and a half into this, I don't think he's paranoid at all. I think that the move is orchestrated. I've watched it move from Europe, from a group like Movendi International in Stockholm, into gaining influence in the World Health Organization. And then I thought, well, okay, it's not coming to North America. I can't see this movement taking root here. Then I saw what happened in Canada a couple of years ago, where some of these Movendi connected researchers that had taken money for traveling fees, et cetera, from Movendi, were very influential in getting the Canadian government to revise their recommended alcohol consumption guidelines. And I'm seeing the same researchers, I'm seeing the same names on research papers that are being used by organizations in in the United States. And so I'm beginning to see the influence more and more. Now, whether it's coordinated, I don't know, but it seems like they're finding one another. And so if you go to the Movendi International website, you'll see that there's articles about what's happening in Oregon. There was an article about Rethink the Drink, where they were basically saying to Oregon, public service announcements aren't going to cut it. They're not good enough. You've got to have policies like increase excise taxes and things that restrict accessibility, availability, and visibility. And so I looked at that and thought, okay, still not here yet. But then I started looking at things Oregon Health Authority was doing this past summer, where they sent out a questionnaire to randomly selected Oregon citizens. And it was just a bunch of questions about health policy, public policy, alcohol policy. And one of the questions was, do you think the alcohol industry is intentionally gearing its advertising to minors? And everybody kind of looked at that question, because people that actually received the questionnaire started sending it around to other people going, what is this all about? And so I asked the Oregon Health Authority point blank, I mean, why is this question in the questionnaire? Do you have any evidence that like the Oregon alcohol industry is gearing advertising towards minors? And the answer was yes. We have some evidence to that extent. And they talked about how if you walk into grocery stores, you'll see displays of beer cases, wine case stacks, brightly colored energy drink bottles that have alcohol in them, and that those are placed within 6 to 12 inches of toys and candy. So I thought, okay, I'm not sure how the industry per se is responsible for the placement of those things. We do have regulations on hand already that you can't sell alcohol to minors. So if the stuff is sitting there, I don't know how they're supposed to be getting it. But anyway, that all started surfacing. In fact, I'm looking on my computer right now behind me. There's a there's a page that the Oregon Health Authority does called Place Matters. And on this page, they equate alcohol and sugary drink producers with what they call big tobacco. And so the notion of imagining communities where there are fewer places to buy alcohol, asking the community to imagine where there are fewer days in a week where you can buy alcohol, maybe a blue law where you can't sell on Sunday, controlling the visibility of the product somehow so that kids can't see it, which I guess would put alcohol, beer, wine, cider in a back room of the grocery store, sort of like the adult section of an old Blockbuster video where you've got to go through beads to keep it out of the vision of children. Yeah, I'm not sure, but it seems to be this is the kind of direction that we're headed.
Sure, and they're going in this direction, going after things that are more agreeable to the most people to kind of get their message across. Like nobody's for having children drink, so they can go for that. But I mean, their ultimate goal is not a drop. Like nobody drinks a drop.
Yeah, well, if you look at the website for like groups like Movendi International, I mean, they call their programs alcohol prevention. I mean, they're pretty open about a perfect world would be a world where there was, no alcohol being consumed or produced. So Movendi's a little more open about it. And I mean, groups like the Oregon Health Authority are bound by the federal guidelines of, moderate consumption is 14 glasses a week for men and 7 glasses a week for women. But, when you ask about that, there's always this caveat, but the less you drink, the healthier it is. And almost like the closer you get to zero, the better it is for you. And I don't necessarily think that the science bears that out for in all cases. And I've learned in the last year and a half, there's one thing that public health policy people don't do well, and that's a nuance. So it's beating people over the head with a big stick to get attention. And
And those are the federal guidelines for now. So we very much wanted to do this story about Oregon last year because it seemed like Oregon was a place where these forces from outside the state were marshaling, and it was kind of a patient zero of trying this more extreme alcohol temperance legislation or regulation. And then as we went to press, the Surgeon General released his advisory talking about a potential link between alcohol and cancer, and all hell broke loose when it relates to alcohol and health. And obviously, you've watched that closely. What's that advisory based on, the Surgeon General's advisory?
Well, if you look at the 2025 Alcohol and Cancer Report, the Surgeon General's advisory, they list a handful of studies that you can go look at in the website and look at and link to. And the studies use a probability equation that epidemiologists use all the time, in which you take the rate of consumption and punch in numbers for RR, relative risk, and you come out with a number. And so the number that they came out with, that's in all the mainstream media articles, is in a year, 20,000 people in the US died because of a cancer that was related to alcohol. And then in the same statement, the Surgeon General talks about how the link between alcohol and cancer is causal. So I think that when people see that headline and they see that in articles, they immediately think it's just like tobacco. Alcohol causes cancer. And that's not necessarily accurate to try to equate. I know why they're trying to equate alcohol and tobacco, and we can get to that in a minute. But the two things are different in terms of risk exposure. And so what was interesting is when people started digging and these news articles started appearing. So Time Magazine, New York Times, Wall Street Journal, and all of the articles were the same. Here's what the Surgeon General said. There's a link to cancer that's causal, and it kills 20,000 Americans a year. They might go find somebody from a medical university to give a quote about, hey, it's about time they started saying this. We approve of this. But there was never any discussion about the science behind the recommendation. Nobody was asking questions about how they came to that conclusion. Nobody was asking questions about, did all of these studies control for tobacco consumption in conjunction with alcohol? Were people that smoked and drank separated out? How did they do that? There's 1,000 questions, but none of that was discussed, and none of that was questioned. Nobody dug into the study that he referenced from the CDC on 20,000 deaths to see that something like 87% of that 20,000 death total was due to people, it said, that were exceeding the federal recommended guideline. In other words, 87% of the scary 20,000 deaths were evidently because people were drinking way too much alcohol. And that's a point that's missed. I don't think
That's more than the 15 drinks a week.
Yeah. And if you're drinking more than the recommended guidelines, 14 glasses for men and 7 for women. And so that doesn't get discussed. So, now we're down to a much lower than 20,000. And nobody put it in the big picture of several things. One, the thing that got ignored, and whether it was intentional or just a convenient ignoring, was that the National Academy of Sciences study that came out in December, like 3 weeks before the Surgeon General's announcement, said that in terms of all-cause mortality, alcohol still has a beneficial effect, and that ignoring all-cause mortality results, which subsumes cancer deaths, that was interesting that was left out of the equation. That there was no discussion of the fact that when you look at all things total, from moderate to low wine consumption, you get some benefits from alcohol consumption. And so it wasn't as cut and dried as they wanted you to think, evidently. And so that was left out. But also, too, cardiovascular disease kills more people in the US and Canada than cancer does. Why are we ignoring the stuff the National Academy of Sciences report had to say about the still beneficial impact of moderate to low amounts of alcohol for cardiovascular disease?
In addition to producing world-class content, did you know that Wine Enthusiast is also the premier shopping destination for wine lifestyle products? Just visit our shop at wineenthusiast.com, where you'll discover an amazing assortment of unique quality items guaranteed to enhance your wine experience. From glassware and accessories to thousands of unique wine gifts, it's like a toy store for wine lovers. And don't forget about protecting your wine. We are the nation's leading retailer of wine storage products. Whether you have 600 or 600 bottles, desire a wine cabinet, or a custom-designed wine room, our free wine storage consultations will help you find the perfect wine fit for your collection. Visit wineenthusiast.com today. We bring wine to life. Brought to you by the Wine Enthusiast Shop.
And we had started talking about Movendi earlier, and a lot of what came through Oregon seemed like it was straight out of their playbook, and was their words and their stances, and even things that came out of the Surgeon General, who's not a medical researcher, seemed like they were straight from Movendi as well. Can you just give us a little more detail on who Movendi is and how they're such an influential force in this year?
Back in the late 1800s, it was a group based in upstate New York called, I think, the International Order of Good Templars, and they were a temperance movement, and they were very influential in getting the Prohibition Amendment passed in the United States Constitution. This is basically the same group of folks. The name was changed. So you've got Movendi International, and they're based in Stockholm, Sweden. And so they become a very, very, very influential group. And for them, big alcohol is this evil, lying entity that's out to enslave people for profit. And for them, big alcohol is just as bad as big tobacco. And so the more you can equate big tobacco with big alcohol, the easier it's going to be for what I think I'm seeing is coming. And so let me give you a snippet from the Surgeon General was on PBS's Science Friday the other afternoon. And he said cancer as an issue is important to people. People understand it. I'm paraphrasing him now, but he said that by drawing the connection between alcohol and cancer, it would make it easier to get legislation passed in Congress. And he drew allusions to what the Surgeon General did in 1964 with tobacco labelings. So the idea that cancer is scary, it's relatable to people because almost everybody that you know knows someone else that's had cancer, and it can be extremely emotional, especially when breast cancer becomes involved. And so it's an effective tool, and I just didn't expect him to say it out loud like that on PBS. So if you zoom in on cancer and ignore all-cause mortality, if you zoom in on cancer and ignore the beneficial impacts that moderate alcohol consumption has on things like diabetes and dementia, not to mention cardiovascular disease. If you exclude all that out and dial in on just cancer and don't say anything about anything else, then it becomes clear that it's a rhetorical strategy to enable, first of all, Congress to do two things. He wants a cancer label warning to be put on alcohol beverages. And then he wants Congress to consider revising downward the federal guidelines that we have now at 14 and 7 glasses a week. In fact, on the PBS show, he literally said that if we want to have fewer people dying of cancer, then we need to lower those guidelines. I think there's an automatic assumption when people see those headlines that 20,000 people are dying. We should be able to go to hospitals and talk to doctors that sign the certificates that they're dying. But that's not necessarily the case. So we need to look at the bigger picture of alcohol in terms of health, and maybe not just dialed in on cancer, and to put it into the big picture equation and talk about the other things that are involved as well in terms of all-cause mortality.
Yeah. So the Surgeon General cherry picked the data to come up with this argument, released this alarmist advisory that got kind of predictable
Well, it's
baity headlines.
It is it is an effective strategy. I mean, we could talk all day about why we shouldn't be equating the cancer risk for tobacco with the cancer risk for alcohol. It's like apples and oranges. I mean, with tobacco, you're directly introducing a carcinogen directly into the lung tissue with no mediating factors per se. I mean, you could talk about the differences. I don't know of any studies out there that talk about beneficial impacts of low to moderate consumption of tobacco. Maybe there are, but I think there's a lot of differences between, that won't allow you to equate, quote, big tobacco with big alcohol. But the research groups that are out there, there's a fellow who, Dr. Peter Bach, he's an oncologist at Memorial Sloan Kettering Cancer Center in New York. And I thought he had a great quote that I saw in a newspaper article a few years ago that was completely unrelated to this matter. But he said, there's a very big difference in the scientific world between the people who have a view and seek data that confirm it and the people who are inquisitive and seek data that will educate them. I think we need to have more of the latter and less of the former.
Yeah, and now, so we've seen this sort of exploding, I guess, across the national stage with this news for the past couple of weeks, but with our, sort of premise that this has been playing out in Oregon as it has, where are those outside influencers or the people who were involved in Rethink the Drink in Oregon? Where are they going next? Like they're going to go to other states, right?
Well, from talking to people here in Oregon, well, first of all, the fellow that was the director of the Oregon Health Authority in Oregon, he when there was a change in governors, he packed up, resigned, moved to New Mexico to take over their health division. And there were discussions in the early goings when he was down there of instituting something like Rethink the Drink in terms of getting alcohol situations under control in New Mexico. So the actual phrase Rethink the Drink was discussed in newspaper articles in New Mexico at the time. So this was about 2023 into 2024. I called him. He was gracious enough to talk on the phone with me for a few minutes last, I think, what was it, November, before this article went to press. And we talked about it, and he said, "Oh, he goes, I don't have any plans." He goes, "We need effective alcohol policies in New Mexico, but at the moment, I don't have any plans for anything like Rethink the Drink." And then I thanked him for his time, and I hung up. And then his media director emailed me 4 hours later and said that he resigned. It's like that day, out of the blue, it appeared people were surprised by this based on the reaction of the media down there. But so I don't know what will become of Rethink the Drink in New Mexico now. There's rumblings about it in Colorado. Oregon Health Authority has a partnership with a construction group I think based in Oregon, where they're trying to tackle construction industry suicide by having Rethink the Drink for construction workers as a campaign. I think they even did stickers that say Rethink the Drink that go on hard hats. So it's branching the messages. The folks at Oregon Health Authority, they refer to Rethink the Drink as a brand. And we know that any successful brand gets replicated. They seem to be happy with the way Rethink the Drink is going. I can't imagine this won't get replicated. And the example I use is we talked about what happened in California with sugary drinks. Talking about sugary drinks, about 10 years ago, there was a campaign called Rethink Your Drink, and it was to curb the consumption of sugary drinks. And it started in California. And then before you know it, within a year, there were Rethink Your Drink programs in Hawaii, I think Arkansas, all around the country. So it spread. So I have no reason to believe that Rethink the Drink as we have it here in Oregon will probably appear in some form or another in many other states across the United States. And that Rethink Your Drink, they changed one word, was about sugary drinks. And if you look at the science data and the numbers for how many people die from the consumption of sugary beverages in the United States, it's more than the Surgeon General's quote about cancer due to alcohol. So I don't know when we're going to get the cancer warning labels on Coca-Cola. I won't hold my breath, but in the grand scheme of things, maybe it's something to consider. But anyway. So yeah, I think you'll see it replicate. I'm sure you'll see Rethink the Drink in other parts across the country.
Well, hopefully, today we've helped a little bit with people interpreting the news, and I thank you for spending your time with me today. Appreciate it.
Well, let me leave you with one little tidbit.
Sure.
And I'm going to read this from a piece of paper so I don't get this wrong. This is a quote, and then I want to run through your head. Who do you think this came from? It says, "New discoveries about what causes or might cause cancer seem to be made nearly every day. When you see a story in the news linking something to cancer, especially if it's something you're exposed to on a regular basis, your first reaction is often to think that we need to avoid it at all costs. But it's usually not that simple. Usually, it's hard to get the full story."
Dr. Seuss.
That is from an article called How to Interpret News About Cancer Causes on the website for the American Cancer Society.
Huh. Very helpful.
So we need to take their advice. We need to do more digging, and we need to ask more questions, and we shouldn't accept statements on face value.
All right, Michael, thank you very much.
Okay, thank you.
These issues are, of course, complex, and much of the information out there seems at odds, and it can be confusing. Hopefully, you feel that you have a bit more understanding of them now. If you have questions or comments, you can email us at podcast@wineenthusiast.com. And remember, you can subscribe to this podcast on Apple, Google, Spotify, and anywhere else you listen to your favorite podcast. You can also go to wineenthusiast.com/podcast for more episodes and transcripts. I'm John Capone, Executive Editor of Wine Enthusiast, and I thank again Michael Alberty, and I thank you for listening.